Today, we're going to put that to the test with a little pop quiz. Let's get started. You've got what it takes to be a nurse. I mean, really, it's so much more than just a job. It's a profession that demands us incredible range of skills. Today, we're going to put that to the test with a little pop quiz. Let's get started.
I mean, have you ever really stopped to think about it? We see them in hospitals and clinics, but what's the actual knowledge base they're pulling from every single day? It's this wild mix of science, ethics, procedure, and yep, even math.
So here's the deal. We got our hands on some questions from a real professional nursing exam. Now, full disclosure, the original source has a couple of typos, as you can see, but we'll read the questions out as they were intended. We're going to treat this like a pop quiz. I'll ask the question, you go ahead and lock in your answer, and we'll see how you do. Ready?
Okay, first up, let's talk fundamentals. These are the core concepts, the very bedrock of all nursing practice.
All right, question 1. Let me just clarify the wording from the source here. What is the fundamental role of a professional nurse? Your options are A, matron, B, care provider, C, surgeon, or D, counselor. Think about what the most central, the most defining duty of the profession is. Got your answer? And the answer is B, care provider. If you got that, nice work. Now, while nurses definitely do counsel patients, and metron is a real term for a head nurse or manager, the number one all-encompassing role for every single nurse is providing direct patient care. And this definition really gets to the heart of it. This role isn't just about performing a list of tasks. It's about managing both the physical and the emotional needs of a person. That holistic approach, well, that's what makes a great care provider absolutely critical. Okay, let's move on to our next question. This one might seem pretty simple on the surface, but it's a key procedural term. What do you call the act of preparing a bed with fresh linen? Is it a bed bath, bed shampoo, bed making, or bed linen? The correct answer is C, bed making. I know. It seems obvious, right? But in a clinical setting, using precise language is absolutely everything. And here's exactly why that precision matters so much. Bed making isn't just some form of housekeeping in a hospital. It is a core nursing skill, and it's tied directly to patient health. A properly made bed can literally prevent painful and dangerous bed sores, keep a patient comfortable, and maintain a hygienic space to stop infections. It's a huge deal. Okay, so we've covered the basics. Now, let's raise the stakes a bit. These next questions are all about the tough calls that nurses have to make when the pressure is on and every single decision counts. I want you to picture this. A patient is insisting they want to leave the hospital, against medical advice. What is the nurse's first move? Should they, A, start arranging transportation for the patient, B, call the pharmacy to get their prescriptions ready, C, immediately notify the nursing supervisor, or D, discuss the risks of leaving with the patient? This is a true test of priorities. The correct, and without a doubt the most critical, first step is D. Discuss the potential consequences of leaving with a client. And here's why that's so important. Patient safety and informed consent come before absolutely everything else. Before dealing with any logistics, the nurse has an ethical and a legal duty to make sure the patient fully understands the risks. This is how you respect the patient's autonomy while also fulfilling your duty to care for them. All right, now for a completely different kind of precision, clinical math. A pregnant patient's last menstrual period, or LMP, started on March 2nd. If today's date is May 8th, what is the gestational age? Is it A, 10 weeks and 5 days, B, 8 weeks and 3 days, C, 9 weeks and 4 days, or D, 7 weeks and 2 days? Take a second to think through the calculation. If you calculated C, 9 weeks and 4 days, you absolutely nailed it. This kind of calculation is a routine but totally vital part of prenatal care. So, how do we get there? Well, it's a simple, step-by-step process. First, you count the remaining days in March, which is 29. Then, you add all the days in April, that's 30. And finally, you add the 8 days in May. That gives you a grand total of 67 days. You divide that by 7, and what do you get? Exactly 9 weeks and 4 days. Precision is key. For our final question, we're taking a sharp turn. This one might actually surprise you, because it shows that modern nursing extends way, way beyond the bedside.
A question about marketing on a nursing exam? Really? Okay, here it is. Which of these is a promotion tool used to develop marketing plans? Cost components, market position, slogan, or advertising? What could this possibly have to do with nursing? Go ahead, lock in your answer.
The correct answer is D, advertising. I know, it feels like it came completely out of left field, but there's a very important reason it's on this test. And this is where we see the true, modern scope of nursing. They aren't just clinicians at the bedside. Many are managers, administrators, and public health leaders. I mean, think about it. How do you run a successful vaccination campaign or a diabetes prevention program? You need marketing to reach the community effectively. Nurses are deeply involved in the business of health, promoting services and educating the public on a massive scale.
So, after that quick quiz, what did we learn? What does it really take to be a nurse?
What this quiz really shows is that a nurse's toolkit is just incredibly diverse. It requires that foundational compassion, absolutely, but it also demands the precision of a technician, the moral compass of an ethicist, the accuracy of a mathematician, and the strategic mind of a systems thinker. It's a profession that demands you use your whole brain. So I'll just leave you with this question to think about. After seeing just a tiny slice of what they need to know, from ethics to marketing, what do you think is the most surprising skill a nurse needs to have? The answer, I think, is far broader and more complex than most of us ever imagine.